Hi, good morning, everyone. I'm Dr. Ramni Ranjan, Senior Consultant Neonatologist and Pediatrician at Apollo Cradle and Children's Hospital, Greater Noida. So, today we are going to speak about neonatal screening. What does it mean? What is the importance of neonatal screening? What do we need to know as parents? So, it will be a brief session of around 15-20 minutes, wherein I will be talking about neonatal screening, different aspects. And at the end of the session, we'll have a question and answer sessions like we do every time. And we'll try to answer each and every question that you put in here. Right. So, what screening actually means? So, screening is basically a test which is conducted in apparently healthy individuals to know the incidence or prevalence of a particular disease. So, what happens in apparently looking well babies or newborns? Uh, it has been seen in different studies all across the world. There are certain congenital conditions which may still be present, and if we miss those diseases at the time of birth or in the neonatal period or in the infancy period, then later on, if this disease remain undiagnosed, then it may cause serious issues in terms of development of the child. So it is very important to identify these rare yet very significant diseases, and that is the purpose of doing neonatal screening. So, as a matter of fact, all across the globe, in developed countries, in European countries, neonatal screening is a routine stuff. Even in India, also many centers do it as a routine, and many centers are now coming up with a protocol to start doing neonatal screening. So many times it is kind of an enigma or a question for parents that what is the reason to do it, because there is a cost factor associated with this. So I'll try to answer all these questions in this session, and as I said, if there is anything we can discuss at the end of the session. So screening, as I have already explained, that it means even for an apparently healthy, well newborn baby, we have to conduct certain tests just to make sure that everything is fine. In a very rare incidence, a newborn may be diagnosed with a disease which is very rare. So what are the diseases that we need to screen? So as I said, these diseases are rare, but they have got a very significant impact on development of a child if it is missed during infancy or early childhood. The idea is to get hold or get diagnose this disease as early as possible, so that remedial measures can be instituted as early as possible, and the damage, if at all is there, can be minimized or maybe aborted at all altogether. So in terms the tests which are included in newborn screening, so one is basically a blood test, or what we call as a dry blood spot, wherein a few drops of the baby's blood is taken on a dried blood spot. Usually, newborn screening blood test or the dry blood spot test is conducted at around 72 hours of life, that is after 3 days of age, but it can be conducted usually after 48 hours. So this is basically a very, I would say, something which doesn't need a lot of pricking or lot of trauma to the child. Usually, a heel prick is good enough to get that amount of blood. It's just few drops of blood that we need. It is collected on the dried blood spot paper or blotting paper, special kind of paper which is used for these tests. And then these samples are sent across the laboratories, which report usually within 5 to 7 days. So the tests included in this newborn screening panel, it can be multiple depending upon what do you want to test. So basic screening, basically what we do, it includes 7 diseases. So what are those diseases? So let me just brief you about the diseases. So the diseases included are G6PD deficiency, 17 OHP test, which is for congenital adrenal hyperplasia, cystic fibrosis test, feline phenylketonuria, galactosemia, congenital hypothyroidism, and biotinidase deficiency. So you may find these all names very, I mean, strange, but these are, as I said in the very beginning, that these are rare diseases, but they have got all of them have got a very significant impact if they remain undiagnosed. So the idea is to not to miss even one child with all diseases, especially congenital hypothyroidism G6PD, which is not very uncommon even in Indian scenario. So every now and then we come across babies who have congenital hypothyroidism, and thyroid hormone is such an important hormone for baby's overall growth, especially neurodevelopmental growth. So baby who is deficient in thyroid hormone for some reasons, either the body is not making, or if the gland per se is not well formed, whatever be the reason. So if there is deficiency of thyroid hormone in the body in the newborn's baby, then the overall growth of the infant may be impacted, and there could be multiple issues, neurodevelopmental outcomes, growth. So it's something which we do not want to miss. Similarly, G6PD deficiency. So it is basically an enzyme which is there, which is present in the RBCs, and deficiency of this enzyme makes RBCs liable for breakage. And uh, a baby or a person who is G6PD deficient, if he or she is exposed to some kind of stress, the RBCs might break down, and it might lead to jaundice or sudden drop in hemoglobin. So as I said, if we already know that a particular baby or a child or a person has got G6PD deficiency, then we can avoid certain medicines, certain situations, certain foodstuffs, which are uh, uh, more likely to lead to these kind of episodes of hemolysis, jaundice, and all. And that is the idea of screening such, I mean, all the children at the time of birth itself. Similarly, 17 OHP for congenital adrenal hyperplasia is something which we do not want to miss. This is because of the problem with the hormone imbalance inside the body. And then similarly, cystic fibrosis, which is again a rare disease, genetic disease, phenylketonuria, and biotinase deficiency, as we have already discussed. So these are important to diagnose at the time of birth, or maybe early infancy to be appropriate. In For congenital hypothyroidism, some of the centers also send cord blood. So cord blood screening is also done. So what we do is to collect sample from the cord blood itself, and we send it for T4 TSH tests, and the reports are usually available in 24 hours, and we get to know what are the TSH and T4 reports. Based on this, we confirm whether a child is deficient in, hypothyroid, whether the child is hypothyroid, or maybe is having normal concentration or normal levels of thyroid hormone in the body. So these are the tests which are done at the time of birth. Apart from this, there are other some non-invasive tests. Non-invasive tests means wherein we do not need blood. Tests like hearing screen, which many of the parents already are aware. So child, usually before getting discharged, we ask the hearing guys, the audiologists, to come and do tests like OE and beta, wherein hearing, uh, the baby's hearing is tested and accordingly reported. If everything is fine, you would be said that OA is bilaterally passed, or beta is bilaterally. Bilateral means both sides are okay. If there is an issue, you might be asked to get the baby rechecked after a certain span of time, maybe a month or something. So this is to make sure that the baby's hearing is absolutely fine, because hearing is something which, again, we want to make sure that hearing is absolutely fine, because again, it's a very important component of overall neural developmental outcome. So if the baby's hearing is impaired, the baby will not be able to hear properly, and so the speech will be delayed, and the interaction, communication, the whole and a whole lot of developmental problems would be there if the baby's hearing is impaired. So by doing these tests, we want to make sure that the baby's hearing is fine. The other test that we do is a eye test as well. So something called red reflex, wherein we put in some light through an ophthalmoscope. We check the baby's lens, and overall the eye looks good. This is done by doing a test called red reflex test. Sometimes neonatologist pediatrician can do it. Sometimes an ophthalmologist might be required if there is any doubt. So this is something which also we want to do before a child goes home. Apart from that, we also do hip screening for developmental dysplasia of it, wherein a certain maneuver is done before getting discharged, and if everything is fine, it is written as the hip test. Yeah, hip ortolanius or Borlow's tests are normal. That is to make sure that the baby's hip are moving in the right way. There is no click, there is no displacement. Some babies who wherein there is a family history of developmental dysplasia of hip, or if they're born through a breech delivery, or the presentation had been breech, these babies first female born child, so these babies are at slightly higher risk of developing what we call developmental dysplasia of hips, wherein the way the hip bone attaches to the the pelvis, or the long bone of the lower limb attaches to the hip is slightly different, so it gets displaced. So it is again very important to identify it early, so that the remedial measures can be applied early on. And if it is identified early, there will be less hassles making it normal, rather than diagnosing it late, wherein a surgical intervention might be needed. And then also we sometimes we conduct what we call bilirubin testing before going home as well. This is to make sure baby's jaundice levels are within normal limits. So most of the newborns will have some amount of jaundice. We say up to 60 to 80% of the newborn babies can have some amount of jaundice, but only 10% of these babies they require treatment. So by doing these tests, why we want to make sure that the jaundice levels are okay for the baby, and we do not want to treat. Or else if it is high as per the charts, we might go ahead and treat it by using lights or phototherapy. So these are the different tests that we conduct before sending the baby home. So just to give you a little summary of what we discussed, so we conduct newborn screening, which is a dry blood spot test which needs few drops of baby's blood. It is a test which doesn't require a lot of trauma or a lot of pricking and all, just a few drops of blood through the heel prick. The reports are available within 5 to 7 days, and it tests for 7 rare yet very significant diseases, of which hypothyroidism, GSXPD are really important. Secondly, we also conduct non-invasive tests like hearing tests for the babies, red reflex, that is eye screening for babies. For premature babies, we also do a test ROP screening, which is separate, wherein an ophthalmologist is required to come to the hospital, or the baby goes to the ophthalmologist, wherein special screening is done for premature babies. And apart from eye, we also do hip screening. And lastly, as I said, jaundice or bilirubin screening. So by doing all these tests, we want to make sure that when the baby goes home, we have excluded all the important diseases which have got important bearing later on in life, which can impact baby's overall neurodevelopmental outcomes. And as I said, from timing point of view, usually most of the tests are done at around before discharge of the baby, so 48 to 72 hours. If you go home, if the mother is discharged from the hospital early, we might ask the parents to come back in the OPD to conduct this test. So it all depends at what day of life the baby is going home after delivery. So if it is like day 3, we would like to do all the tests before you go home. But if going early, we might ask the parents to come back again and get this test done. From a cost point of view, I do understand it has got cost implications. So I think it's good to have a discussion with the pediatrician. What are the tests which are to be offered? What is the cost factor? And I think when you sit with your doctor may be able to tell you why these tests are required and what is the importance of these tests, and accordingly you can decide what is good for the baby. In an ideal situation, as I said, in most European countries, in most developed countries, the tests which I have already said are already being done, and the ideal thing is to get all of this done. But the best I think discussion with the pediatrician, we need to make sure at least we do not miss on congenital hypothyroidism and GSXPD hearing tests and red reflex and other non-invasive tests. So I think from pediatrician point of view, also from a doctor point of view, also we also want to make sure when the baby's come for follow-up, we either these tests have been done, or maybe depending upon what has been done and what has not been done, you may be advised to undertake these tests. So many hospitals have got in-house audiologists. Sometimes the hospitals might ask the audiologist to come on a routine basis to get the hearing test done. Usually the newborn screening test is sent somewhere outside, so it takes 5 to 7 days for the reports to come. So it's important to follow up with these reports, whether it is normal or if there is anything abnormal. You might be asked to undertake few more tests for confirmation, but it's a rare situation wherein a test comes abnormal. The whole purpose is to not to miss even one baby with any of these conditions like we discussed. Right. And I think this is it from my side. From I can go through the questions now. So the first question is: once babies are diagnosed from any the disease, can it recur later in life? So basically, once it is diagnosed, we can take the remedial measures, Smriti, and accordingly we can advise parents. It's something which is many of times it may be treatable, it may not be treatable, but the idea is to minimize the impact of this disease on child's overall growth, and it is definitely possible, and that is the very purpose of screening. If we cannot do anything about the disease, there is no point, doing everything or testing everything. But this disease which we have talked about, they they can be diagnosed early, and remedial measures can be applied so that uh, the child doesn't suffer. Can these be genetically transferred? The next question. Yes, possible. Some of them are genetic diseases as well. And depending upon what the reports are, you may be advised to undertake few more, blood tests and all. So for newborn screening, there are multiple tests available. There are multiple panels. So basic test is a semen panel. Then there could be something like 50 panel, 100 panel, or a TMS as a whole, wherein you screen or you test for all the metabolites, different enzymes, inside the body. So depending upon a pediatrician, it can be a basic 7 panel test, or if there is any suspicion of any particular disease, or there is any history or family history of any genetic or metabolic disease, you might be asked to undertake more tests. The extended panel of extended Guthrie or the TMS test. The next question is neonatal jaundice very common? Yes, the jaundice is very common, but most of these children do not require any treatment. As I said, that almost 60 to 80% of the baby, more so preterm babies, can have some amount of jaundice, but only 10% of them will require some treatment. Can diagnosis cause any negative side effect? Well, I'm not sure what this question exactly means, but I presume it's more to do with family. I think if you are able to diagnose a disease early on and take remedial measures, is always good, isn't it? Because you have averted the bad effects of those diseases on the child, rather than remaining undiagnosed, and later on when a significant portion of the brain has already grown, and at that time doing some intervention is less likely to give 100% results. So it's important to diagnose early, act early, so that we know that the child is saved from the detrimental effects of the disease. Next question is: post diagnosis, how every baby should get the baby screening checkup done? So yes, so depending upon what disease is being diagnosed in the screening, there are protocols for this. For example, if the child gets diagnosed with hypothyroidism, we usually undertake few more tests just to make sure, and then there could be other tests like ultrasound, and radioactive iodine and all that tests. And based on this, you might be asked to undertake tests every 2 weeks, 3 weeks initially, until the TSH gets normalized. And so it all depends upon what disease we are dealing with, and there are protocols for that particular disease. If needed, you might be asked to get in touch with a multifactorial team which comprises of clinical geneticist, or a someone who is expert in metabolic or genetic diseases. So it all depends if the screening is positive, and if positive, what disease are we dealing with. Can feeding breast milk cause any problem for the baby? Well, breastfeeding is absolutely safe. There is no doubt about this, and in no circumstances we ask breastfeeding to stop, barring one or two diseases. So, for most purposes, breastfeeding is absolutely safe. Certain diseases like galactosemia, and very rarely if the mother is on chemotherapy and all that, these are very few conditions wherein a doctor might ask to hold breastfeeding. But as such, breastfeeding is extremely safe, very, I would say, natural, and the best thing for baby, or the best food for the baby. So there is no doubt that breast milk should be continued unless the doctor specifically asks not to. So that's it question wise. If there are any more questions, I'm more than happy to take those questions. I think that's it. So just to briefly summarize today's discussion. So newborn screening means screening a newborn for certain diseases which are rare, but uh, these are serious diseases and they have got very adverse outcomes if they are undiagnosed. So it includes a blood test, which is dried blood spot or NBS, which can be a very basic 7 panel test or it can be an extended test based on doctor's discretion, and other screening tests like hearing screening, red reflex or eye screening or ROP screening for newborn premature babies. And then we test for developmental dysplasia of hip, and then jaundice test, hearing as we have already discussed. So these are the tests which we normally do before the babies go home after delivery. But sometimes if the babies go home early, we might ask the parents to come back and get this test done. It's important to get these these screening tests done. This is to make sure that the baby's um, growth and overall neurodevelopment outcome is appropriate, and we have not missed out on these rare but significant diseases. Right. So thank you very much for your attendance and kind and patient hearing. If there is anything, I can always be reached at Apollo Cradle and Children's Hospital, Greater Noida. Thank you very much.